You're watching City Channel 4, your window to our community.
So now I'd like to introduce our speaker for the evening, Dr. Luke Brunkhorst. Dr. Brunkhorst is an Iowa boy. He grew up in Iowa Falls. He's a graduate of Iowa State University, but I told him we wouldn't hold that against him. He received his medical education at Des Moines University, and he did his residency at Metro Health Hospital in Wyoming, Michigan. He joined Mercy's medical staff last year, 2013, and he's a member of the medical practice Urologic Associates of Iowa City, which is located on Northgate Drive in Iowa City, along with many other medical practices. And his colleagues in that practice are Doctors Jim McCoy, Dan Gralnick, and Catherine Eckross. Dr. Brunkhorst is a very active guy. He says that his hobbies include golf, basketball, and water and snow skiing. So please join me in welcoming Dr. Brunkhorst to the podium.
Thank you. All right, hopefully I got my mic on. I usually don't need a mic, though. I got a pretty loud voice. As Denise said, I want to thank everyone for coming out today, braving the cold weather. And I just looked at the forecast. It's not going to get any better the next 10 days. So we're going to talk about erectile dysfunction and what the treatment options are. So we'll talk about what ED is. We're going to talk about how many people are affected. We're going to talk about what are some of the treatment options. Okay? At the end, I'm going to leave a lot of time for discussion. I'm sure a lot of you have a lot of questions, so I'll leave plenty of time for discussion. All right, so what is ED? According to the NIH, the National Health Institute, the definition is persistent inability to achieve or maintain an erection firm enough to have sexual intercourse. And it's really a spectrum. So ED to one person is different to another person. You may have someone with mild erectile dysfunction, moderate, severe. Treatment options for one person is not going to work for another person. How prevalent is it? Approximately 1 in 5 American men over the 20 years old are affected by ED. So that equates to approximately 30 million American men. I recently read a stat where only roughly 5% of men that have ED actually go seek medical treatment or advice for ED. So this is a large number, but it may be even bigger than this. What are the causes of ED? And we break it down here. The biggest ones are vascular and diabetes. We think of these, when we talk about ED, we think of really two broad categories. We think of organic ED, and that's things that cause ED like high blood pressure, diabetes, high cholesterol, coronary artery disease. And then in the smaller category, there's psychogenic ED. Okay, we used to think that ED was mostly in somebody's head. We now know that the vast majority of erectile dysfunction has some pathologic background to it. And as you can see here from the slide, 40% of it is caused by some sort of vascular insufficiency. I always say what's good for the heart is good for the penis, and vice versa. What's bad for the heart is bad for the penis. So if you have high blood pressure, if you have diabetes, especially uncontrolled, if you have high cholesterol, if you smoke, you have coronary artery disease, heart disease, they all affect your heart because they affect the blood vessels. And that's usually what leads to erectile dysfunction, is poor blood flow. Medications, you can see roughly 15% of ED is caused by medications. Some of the more prevalent medications that can cause this would be antihypertensives, so blood pressure medications, with some of the bigger ones being beta blockers and thiazide diuretics. So a common beta blocker would be metoprolol or toprolol. A lot of people with heart disease may take that medication. And then hydrochlorothiazide, HCTZ, that may be a medication that you're on. When it comes to those medications, though, it's not safe just to stop it thinking it's going to improve your ED. You always want to consult with a physician that puts you on that medication. If you have a stroke because you came off those medications, erections aren't going to do you much good. We look at some of the other smaller percentages: pelvic surgery, radiation, or trauma. So some of you men may have had pelvic surgery in the form of a prostatectomy for prostate cancer, or possibly even your bladder removed for bladder cancer. And a large percent of those men may be affected in the form of erectile dysfunction. And there's neurological causes, there's endocrine problems. Some of the endocrine problems may be low testosterone. You've probably seen a lot advertised in the media about low T meaning low testosterone. Some of the potential side effects of that would be erectile dysfunction, low or decreased libido, low energy, fatigue, maybe more depression. And so if you're experiencing some of those symptoms, you may want to consult with your physician to see if it's low testosterone that is causing that. All right, a little bit about how erections work. I won't go too in depth about this, but we'll just follow along on the slide here. Okay, so you start with initial filling. With psychological or sexual stimulation, neurotransmitters cause penile smooth muscles to relax. You get an increased blood flow to the corporal bodies. These are the two, I call erectile chambers within the penis. Then over here on number 2, penile arteries expand to accommodate the increased blood flow needed to elongate and expand the penis. With the full erection, there's increased volume of blood within the penis, and this is prevented from draining, thus expanding the penis to full erection. With a rigid erection, there's maximum rigidity attained. The glans and spongiosum, which is the tip of the penis or the head of the penis, enlarge until penile veins are forcefully compressed. So when those veins are compressed, blood no longer flows out of the penis. And a lot of times in men, you may be able to attain erection, but not maintain an erection. And that's a common complaint that I hear. Yeah, doc, I can get one, it just doesn't last very long anymore. And sometimes the problem is a venous leak. So instead of that blood staying trapped in the penis, by compression of these tiny veins, it tends to leak out. And then after ejaculation, there's a return to the flaccid state. All right, let's go a little bit more into treatment options. So, according to the American Urologic Association, the first line treatment for men with erectile dysfunction is oral agents. So many of you men in this room have probably had some experience with some of these, or at least have heard of them. So those would be Viagra, Cialis, Levitra, Staxin, those medications. So one thing to note here, as depicted on the slide, it's combined with sexual stimulation. So you can't sit there watching the game and pop one of these and expect to get an erection. You have to have sexual stimulation along with it. So I always say these aid in the erection, they don't produce the erection. Again, it works in response to sexual stimulation. It's usually taken within 1 hour before anticipated sexual activity. Most work within 4 hours. That's common for Viagra and Levitra. Cialis, as you may be aware, has a longer duration of its effect. It's in your system longer, for up to 36 hours. And some oral medications' efficacy can be affected by food. So a lot of times when men go in to see their primary care doctor, their urologist, they may not be given proper instruction on how to use these medications. I always tell patients there's 4 things that we need to be aware of to get the most effectiveness from these medications. Number 1, right at the top there, you have to have sexual stimulation. Number 2, take it within 1 hour, preferably, before intercourse. Number 3, know that some of them are affected by food. So some people may not be aware of that. When I say affected by food with Viagra and Levitra, you want to try to avoid taking this after a high fatty meal. With Cialis, there really isn't a need to take it on an empty stomach. And the last thing I always tell people is we need to optimize the dose. So the starting dose for a lot of these medications is kind of in the middle. If that doesn't work, you go up to the next dose. Common side effects, some of you may experience this before: headache, facial flushing, stuffy nose, upset stomach. Contraindications, meaning reasons why you should not take this. You cannot take this if you're taking a nitrate. Nitrates are medications for people with chest pain. Some cautions: be cautioned if you take it with an alpha blocker. An alpha blocker would be a medication like Flomax or its generic tamsulosin. It can cause a decrease in blood pressure. And should not use these medications if sex is inadvisable because of cardiovascular status, although less than 1% of heart attacks are caused by sexual intercourse. And a little bit more about these. So how effective are these medications? In reports, they say they're effective in upwards of 70 to 80% of users. It may be not that high, and it all depends. Again, ED is a spectrum. So someone with mild erectile dysfunction, these medications may work great. Someone with severe erectile dysfunction, and maybe it's after they had a prostatectomy, maybe it's after they had their bladder removed, these medications may not work as well. And so you may have to go on to different forms of treatment. And a lot of you men here in this room may be that smaller percentage that these are not working as well. What are some different treatment options? Vacuum erection devices. Some of you may have heard this or even tried this as well. It's been around since the 1980s. A vacuum erection device consists of a hollow plastic tube, a hand or battery-powered vacuum pump, and a tension ring. The tube's placed over the penis. It creates a vacuum that pulls blood into the penis. Once an erection is achieved, an elastic tension ring is placed at the base of the penis to help maintain the erection. So I had a patient's wife said this is called the mood killer. All right, there's not a lot of spontaneity with this thing. It's big, it's bulky. You know, when you want to have an intimate time, you're going to have to pull this thing out. So spontaneity kind of goes out the window with this thing. But in some men, it can be very effective. And the advantages are, it's not a medication. It's a one-time cost, and a lot of the times, there is no cost to the patient because this is covered by a lot of insurance. So without taking a medication, you don't have to worry about side effects either. What are some of the side effects of this? You may have blocked ejaculation. That tension ring is placed at the base of the penis once an erection is formed. And that tension ring keeps blood trapped in the penis to sustain or maintain that erection. And with that in place, you may have blocked ejaculation. The vacuum that's created here may have bruising of the penis. There could be some penile discomfort associated with that. And a common complaint is penile numbness or coldness. And a lot of times the partners of men complain of this penile coldness. And a lot of that has to do with the type of blood that is in the penis at that time. It's pulling venous blood instead of arterial blood. And so you may notice that coldness. Another complaint with this is at the base of the penis that is not engorged with blood, it may kind of pivot a little bit, and so it may not be as strong of an erection. So what are some of the most common reasons for discontinuation? You may have erections of insufficient rigidity or duration, difficult mechanics, and penile bruising. And when it comes to these devices, there's different kinds. You can go to a novelty shop and get one for $30. These are not medical grade, and they probably are not going to be as effective. And they are not going to be as safe either. So we have a rep that comes to our office once a month, and will sit down with you personally and talk to you about this. They can go over basic instructions of this, make sure that you have the equipment that is right for you. And so for a lot of people, this works well. Intraurethral suppositories. So these are little pellets about the size of the grain of rice that you actually put in the urinary tube, the urethra. When it comes in contact with the tube there, the pellet dissolves, releasing the medication, which then acts locally within the penis to create an erection. How effective is this? Maybe 30 to 40%. So this is not going to be one of your first-line treatments. It's relatively expensive, and some of the side effects or thought of putting something down the urethra is not real thrilling to a lot of men. What are some of the common side effects of this medication? Well, penile pain, and some people describe this as being similar to if you got soap down the urethra, kind of that burning pain that you experience. Most common reasons for discontinuation: insufficient erection, suitable for intercourse, and again, the urethral pain and burning. So we don't have a lot of guys that are using this, but in some men, it's effective, and they're used to it, they're comfortable with it, and we continue them on that medication. Self-injections. This has been around since the 1980s. It's an injection therapy where a needle injects a medication directly into the base or the side of the penis. These medications can create an erection by improving blood flow into the penis. So with these, you don't even necessarily need sexual stimulation. A lot of times these are first introduced to you in the office. We inject the medication into the penis, create an erection. We instruct you on how to do it and how to use it. Now, the obvious downside to this is you're using a needle into the penis. So a lot of men are very fearful of that, understandably. But most men that are using it really say it isn't that bad. And if you think about how many diabetics are out there using insulin, they're not injecting to the penis, but they're used to those needles, and they understand that a lot of these little needles really aren't that painful. And it kind of takes a little bit to get over, that hump of that mentality where you're putting a needle into the penis. But once you can do that, these can be pretty effective. Roughly 80% of men can get an erection with this. The cost of these is better as well than some of these oral medications. So the typical oral medication can be roughly $20 a pill. With this, you can get it for $3 to $4 a dose. A lot of times we do what's called compounding of the medication, where it's a mixture of several different medications into one dose. And we have a compounding pharmacy that we can use. And again, $3 to $4 a dose. And with this, we bring you into the office, we instruct you how to do it, make sure that you're comfortable doing it on your own. Most common side effects, of course, penile pain in roughly a third of the patients. Penile fibrosis, which is scar tissue, can occur. It's not real common, but of course, if you inject enough times, especially in the same spot, you may get some scar tissue that develops there. Priapism. So this is that erection lasting longer than 4 hours. We've probably all heard that in commercials before. Call your doctor if you have an erection lasting longer than 4 hours. I have yet to see an erection lasting longer than 4 hours for men taking Cialis, Viagra, Levitra. I have with these injectable medications. Sometimes it's the young kids getting a hold of dads thinking they're going to impress somebody. So don't let that scare you into not trying this, because it is pretty rare, but it is one of those things that we have to warn you about as a potential side effect. Most common reasons for discontinuation: unsatisfactory erections, pain, and dislike of injections. All right, so many of you men have heard of those, but maybe you haven't heard of this next option. This is the penile implant, or inflatable penile implant. It's been around since around 1972. It was first developed by Brantley Scott down in Baylor, Texas. And it's come a long way since it was initially developed. But what it is, it's a medical device that is implanted into the penis during an outpatient surgical procedure. The device is entirely contained within the body. To operate, one squeezes and releases the pump in the scrotum to achieve an erection. So if you can see from this diagram, first of all, it's completely contained within the body. So some men may be concerned, are other people going to know that I have this? Is it going to be visible? All of the components are completely contained. So when you're not having intercourse and it's completely flaccid, when you want to get an erection, you press the pump in the scrotum several times. Fluid is then transferred from that balloon reservoir into the cylinders in the penis, creating an erection. When you no longer desire the erection, there's a button located right above the pump in the scrotum. You push the button, the erection goes down. The beauty of this is you can be spontaneous again. You can have an erection for as long as you want with this thing. And when you no longer want the erection, you push the button and it's flaccid again. It used to be a concern that you're putting in a foreign object into the body, and infection used to be a big concern. It's now less than 1% in non-diabetics, the risk of infection. A lot of that has to do with changes made to this. It's now impregnated with a antibacterial substance that coats the surface of this, preventing or decreasing the likelihood of infection, to now where it's less than a lot of the hips and knees that people are getting replaced.
What's the infection rate for diabetics then?
In diabetics, it's only 2 to 3%. And it depends, again, how well your diabetes is controlled. So, of course, if your diabetes is controlled to the point where your blood sugars are close to the non-diabetic level, very much less likely that you're going to develop an infection. But of course, if your A1C, which is that marker of where your blood sugars have been for the last 3 months, is markedly elevated, you're at much higher risk. There are several types of types of penile implants. By far the most common and the one that produces the most natural erection is the 3-piece inflatable implant. And that was demonstrated on the previous screen. The 3 pieces being the reservoirs in the erectile chambers of the penis, the pump that's located in the scrotum, and the reservoir that sits behind the pubic bone. Less common would be a 2-piece inflatable implant. This doesn't have the reservoir, but because it doesn't have the reservoir, you can't quite get as much volume into those cylinders, and the erection's not quite as strong. And then you have a 1-piece malleable implant. And so this is where you put malleable rods into the erectile bodies of the penis. When you want an erection, you kind of bend it up, and when you don't want it, you bend it down. So you can imagine the erection is not going to be quite as natural. And when you want it flaccid, that is not going to be quite as natural either. But the advantage is you don't have to worry about pumping anything up. So you don't have to have as much manual dexterity to operate this. Most common side effects or complications, reasons for removal: post-operative, and this would be side effect, post-operative genital pain. This is a procedure, a surgical procedure to implant this. So with any surgery, there's the risk of having pain. Most of the time, it's not too bad. It's relatively short-lived. Possible reasons for removal: mechanical malfunction, including autoinflation. Autoinflation is typically that happens when you sit down and the cylinders inflate without you wanting to. Might not be good in church or a meeting or anything like that. But that's rare anymore. They now have a lockout mechanism to these, and autoinflation, which used to be a concern in the newer models, is rarely a concern anymore. We spoke a little bit about infection, and repeat surgery is possible if you have, this is a mechanical device, anything mechanical has the potential to stop working. So what's the lifespan on these? Roughly 15 to 20 years. So usually these are implanted one time. Insurance coverage. Most of these are covered well by insurance. It's up to the patient to ensure their individual insurance coverage and the potential out-of-pocket costs associated with different treatment options, and we can help you with that as well if you're interested in something like this. You know, a little bit more about these. It's not the natural erection you had when you were 18 years old. I always tell people that. I set up realistic expectations before doing the procedures like this. So some of the concerns or what people sometimes see after this is the erection when this is inflated is not quite as long as what they may have remembered. The head of the penis isn't engorged, and so that's a little bit different. But this has one of the highest partner and patient satisfaction of all of the different treatment options that we talked about. It's anywhere from 85 to 90%. And they've done lots of studies. It's been around for a long time. They've done lots of studies. It's been around here. It's been in Europe. So they know that most patients are quite satisfied with this. Who can treat erectile dysfunction? A general practice doctor, a family doctor. A urologist, of course, that's who I am, is a doctor who has specialized training that focuses on the surgical and medical disease of the male and female urinary tract system and the male reproductive organs. So many of the men here probably have approached their primary care physician first and told them, hey doc, I've got erectile dysfunction. And they may say, well, I've got some samples of Viagra here, try this. And some of the problem with that is, you know, they may not have time to give you the appropriate education on what makes these most effective. And the other thing with oral medications is it may take anywhere from 8 to 10 times to know whether this is successful or not. A lot of men may take this once or twice and say, I got a headache but nothing else. Well, we may not know whether it's been effective until you try it multiple times. And again, you may have to increase the dose and know that you have to take it at least 60 minutes before engaging in sexual activity. And for some men, one of these oral medications may work better than another. They all have relatively the same mechanism of action, meaning most of them work in the same way, but for whatever reason, a patient may prefer or think that one medication works better than another. A prosthetic urologist. This is a urologist who has specialized training and experience in implant procedures. So not all urologists are able to do the procedure to put an implant in. Less than 10% of urologists out there are trained to do this or actually do this in their practice. And so if you have seen a urologist, maybe that urologist did not do this implant and therefore did not make you aware that this was even an option. Many of you men may have had prostate cancer and had your prostate removed years ago and have been suffering with erectile dysfunction and didn't think there were options out there besides some of these oral medications or injectable medications, simply because the urologists that you were seeing wasn't trained in this or comfortable doing it in this and didn't offer you this as an option. And I get a lot of complaints from men, "Doc, I just don't feel like a man anymore. You know, they've tried these different medications and they're just not working. And they simply want to feel like a man again." So for the vast majority of men in this room, there are options for you. If none of those options that you've tried before work, then maybe the implant is for you. Now with that, I have to let you know that if you decide to go with an implant, you'll no longer be able to get a spontaneous erection again. Okay, you'll always have to use the pump. So when we put the cylinders in, you kind of are coring out the erectile chambers of the penis. So if it's removed, you won't get an erection spontaneously again. But on that note, men who are having this placed weren't getting erections beforehand anyway. The final bullet point here, finding a satisfying solution to erectile dysfunction can be a life-changing event for many men and their partners. And that's what I hear a lot too from men and their partners, is they just don't have that intimacy that they used to have. And they really miss that. And they want an option, they want a solution for that. All right, in summary, ED is a common problem. There are a variety of treatment options available. Always talk to your partner. We encourage you to have your partner involved in the discussions. We like to have the partner there if you do, see a urologist, so we can have an open discussion. And talk to your doctor about what treatment options are right for you. So what option may be right for one person is not going to be right for another person. All right, so now we're going to go over some questions here. All right, so I've got one question up here already that I'll start with, and then we can go from there. So again, I talked about erectile dysfunction as being kind of a spectrum of diseases, mild, moderate, severe. And erectile dysfunction to one person may be different to another person. So ED to one person may mean they cannot get an erection at all. To another person, it may mean they can't sustain the erection long enough. To another man, it might mean that there's curvature to the penis. It may mean that there's pain with erection. So there's different forms of ED. So one of the questions I have here, is there any treatment available or anything on the horizon for Peyronie's disease? So some of you men may know what, and probably some of the men here have Peyronie's disease. What Peyronie's is curvature to the penis. And of course there's different degrees of curvatures, different degrees of Peyronie's. Mild curvature, some men may have that and it doesn't really affect intercourse. Some men may have such severe curvature that they're no longer able to penetrate. So the question is there anything on the horizon for Peyronie's disease? And let me go first talk about what are the treatment options available right now. There's never really been great treatment options, unfortunately, for Peyronie's disease in the form of medications. Everything right now, as far as oral medications, are pretty much used off-label, meaning they're not specifically indicated for the treatment of Peyronie's disease. But there are some options available. And some of those options, or the oral medications, may not be that effective. They may take quite a while for them to actually work. And some of them have, side effects too. So there are some oral medications. There's also injectable medications where you actually inject a medication directly into what's called the plaque. The plaque being the area of the lining of the penis that is no longer elastic and where that curvature starts. So there's injectables, and one of the newer ones that is just developed is something called Xiaflex. It's so new, I don't have any experience with it yet. Because of some of the side effects, it requires actually specialized training. They want to make sure that you're trained appropriately for them. But that's probably the newest one that I'm aware of for Peyronie's disease. There's surgical options for Peyronie's disease as well. There's procedures where if you're getting erections but it's curved, you can do a procedure to straighten it. If you're getting erection but they're not quite as strong as they used to be, you can't maintain it very long. For a lot of these men, I put a prosthesis in, a penile implant. With that, it treats both the ED and it also treats the curvature. So it is a great option if you're experiencing both of those. All right, I'll take some more questions. Okay, I've been taking Viagra, 50 milligrams, and it's been working fairly well. How long is it safe to take? And it says I'm 63. No, till you're dead, essentially. It's safe to take long term, as long as you take it appropriately. So knowing that you're not supposed to take more than once a day. If you have severe heart disease, uncontrolled blood pressure, those are reasons not to take it. But otherwise, there's no reason to stop taking it. What in part does having had a double hernia surgery have on ED? You know, I do see men that say they've had a certain procedure that typically isn't supposed to affect erections, but for whatever reason, afterwards they experience erectile dysfunction. Typically, hernia surgery should not have an effect on ED, but maybe some of the effects of pain, maybe medications, pain medications that you're on afterwards could affect it. Maybe there's a psychologic component now, but otherwise hernia surgery shouldn't have a huge effect on erectile dysfunction. Does weight loss have much effect on ED? Yes, so there's been studies that showing exercise and weight loss, discontinuation of smoking, and a healthy diet can improve erections. So for a lot of men, if one of those is true to you, then, you know, improving your diet, increasing exercise, losing weight, stopping smoking, that's a big one. These naturally can improve erections. I see a lot of people who have had or who have ED and start using pornography. Are you seeing this? To each their own, I guess. If it works, whatever works for you. A lot of men, it doesn't matter what the situation is, they're no longer able to get an erection. In some men, maybe there is a psychologic component affiliated with what we call the organic component of it. So in some men, they have an organic component and they're not quite as strong as they used to be or able to last as long. And suddenly that gets in their head, and now you introduce a psychologic component to it. And the next time the erections aren't quite as firm again, and that gets into your head further, and it's kind of this revolving door. And where do you see therapy fitting into ED treatment? And so therapy, and that might mean counseling, I see that fitting into those men that have some performance anxiety, some of that psychological component. There are sex therapists out there that can help you with this. And we can refer you to someone if you think that is true for you. Is it possible to use 2 or more aids at one time? For example, the pill, the pump injection? Absolutely. So some men may use a pill, but the pill isn't quite getting the job done, and so they'll use the vacuum erection device as well. And same thing goes for the injection. So a lot of these have different mechanisms of action, and so you can use those in combination. Will weight loss help with treatment of ED? Again, so this is obviously a common concern, and it can help. Maintaining healthy, ideal body weight. Doing, again, everything that is healthy for your heart is going to be healthy for your penis. So you've probably been told by your primary care physicians, eat better, exercise more, stop smoking, lose weight. They're concerned about the heart. You may be more concerned about the penis, though. Will getting blood pressure and type 2 diabetes controlled help? Again, great question. Yes, it can. Are there any natural supplements that may help? You know, there's not great studies that have shown that maybe some of these natural remedies are effective. And part of the problem may be there's just not any money in some of these, and so studies aren't being done. So you hear a lot about on the radio or the internet or even TV, some of these different products that they're telling you is going to help you get bigger. A lot of that's probably their pockets are going to get bigger when you pay for the pill, but you probably won't see much. So I don't think there's a lot of utility in some of these supplements that you see advertised. Could urethral surgery as a child have caused the ED or worsen it? And a lot of that depends on why the urethral surgery was done. So it could have, especially if erectile dysfunction has been persistent your entire life. It may be not just because of the surgery, but why the surgery was done. So maybe the opening of the urinary tube was not located in its normal anatomic position. And so sometimes ED can cause that problem. But typically surgery on the urethra itself should not affect erections. Okay, I've been a patient of another physician in your office for 30 years. How do I see you without the other physician? You know, we all work as a team, okay? So no one in our office is going to be offended if you see someone else. Again, some of the providers in our office don't provide some of these services, particularly the penile implant. And so maybe that's one of the reasons why it hasn't been offered to you or discussed. And I get some of their patients referred to me for these reasons. So there would be absolutely no reason that you couldn't come see me, and no one would be offended if you wanted to schedule an appointment. Which of the options are covered by Medicare or Medicare prescriptions? So some of you that have been on some of these oral medications may know that there's a lot of out-of-pocket expense. Some insurance companies cover a % of these. The vacuum erection device, Medicare does cover the majority of that, if not all of that. And if you have a supplemental insurance, they may cover the remaining portion of that. As far as the implant goes, that is generally well covered. Any other meds besides blood pressure that affect ED? For example, a statin being a medication for high cholesterol. Not typically. High cholesterol medications typically haven't been a cause of ED. Which oral prescriptions are best? So again, that's kind of specific to the patient. For one person, they may swear by Viagra, and that's the only thing that works. Other patients may say, well, I've tried Viagra before, it doesn't work. Cialis works great for me. So I really can't say that one is better than the other. Some of it may have to do with a side effect profile. So you may have certain side effects with Viagra that you don't see with Cialis. So it's all individualized. After BPH surgery, so BPH surgery is surgery for the prostate, for an enlarged prostate. Can the sphincter muscle be replaced or rebuilt? So that's a good question, because a lot of men that experience erectile dysfunction may also be experiencing urinary incontinence. And urinary incontinence can occur after surgery on the prostate, whether it's removal of the prostate for cancer or whether it's removing part of the prostate for an enlarged prostate. And so the answer to that is yes. And so not necessarily can the sphincter muscle be replaced or rebuilt. Many of you may have heard of slings for incontinence, particularly the women in the audience may have heard of slings. There's actually a sling for male urinary incontinence. If you have kind of a milder form, there is a sling that goes right underneath the urethra that can help with urinary incontinence. If you have a more severe form of incontinence, there's something called an artificial urinary sphincter, which is a cuff that wraps around the urethra and compresses it, preventing incontinence. When you want to urinate, there's a pump in the scrotum, very similar to the penile implant. You pump that pump in the scrotum, the fluid goes out of that cuff, opening up the chamber, allowing you to urinate. After several minutes, the fluid goes back into the cuff, essentially kinking off the urethra, preventing incontinence. Having a very low testosterone level, what harm can it do to my body? So there's been a lot of studies out there about the effects of low T, and maybe some of you have heard of it in some advertising. We know that low T can decrease muscle mass, increase adipose or fat tissue. It can have an effect on your bone health. It can have an effect on your heart health. And so replacing testosterone, it may help with erections, but it also may help with some of the things that I just mentioned. Is there a synthetic I can take to put this back in my body? So yes, there is testosterone replacement therapy, and there's different forms of testosterone. There's injectable, so that's a shot that typically you get around once every 2 weeks. That's typically the cheapest form. Disadvantage to that is you tend to get some highs or some peaks and troughs with that. But for many men, it's a great option. Newer options are gels. So there's testosterone, the gel that you apply once a day, and there's various forms of that. You can apply it to the shoulders. There's actually something you can apply like an underarm deodorant. And so there's different options. There's actually pellets that you can place underneath the skin, which slowly release testosterone, and so you don't have to worry about transference of testosterone that you may have to worry about with gels, and you don't have to do it as frequently as the daily gels or the twice monthly injections. Can hip replacement surgery cause ED? Again, not necessarily. So typically surgeries that affect erections are the ones that affect the nerves that go to the penis. So I mentioned prostate surgery, bladder surgery, also AAA, an aneurysm, if you had an open surgery for that, a colon resection, especially if it was an extensive colon resection, may affect that. But a hip surgery, because it's nowhere near the nerves of the penis, won't necessarily affect it. Again, sometimes there's a psychologic component that ensues with any type of surgery that you have. Is the penile implant covered by insurance? Again, yes, most insurances cover the implant. If you have been on Lupron 3 times, Lupron is a medication for advanced prostate cancer, and PSA went from 4 to 0.5, and PSA of 10 to 0.13. Will an erection ever come back? Does Lupron destroy desire of a woman? So when you're on these medications, this Lupron, some of it, sometimes we refer to as hormone therapy or shots, hormone shots. Because the testosterone has dropped down to essentially 0, it can affect erections. So will the erections ever come back? Sometimes we take a break from these hormone shots, and when you take a break and your testosterone rises again, you may see a return of erections. But again, it all depends on how was your erections before you started getting these shots. If your erections were non-existent before the shots, they're not coming back once you take a break from these shots either. Oral prescriptions are expensive. I was told greater than 90% order them from Canada / the internet. Are these safe? You know, I've had several patients that have done this as well, and you can get them for cheaper. One of the problems is we don't know how much active ingredient is in each of these. So you may be getting some sugar along with a little bit of Viagra. So I can't put any guarantees on what you're getting when you order these. So there is definitely that risk that you take with it. But some men get it and they find that erections work well. So I guess more power to them in that sense. And two, should we try different orals before trying the Canada route? You know, that's always a good option. We do have samples in our office, so for a lot of these men that I see for the first time, I give them samples of various oral medications and let them find out what works best for them, if any work. So that is definitely an option to do that. All right. That's all the questions that I have here on paper, unless anyone back there has any more. Yes.
Sorry,
No problem.
didn't know you had to write it on.
That's fine. It's completely up to you.
I always stutter when I'm really. How much nerve damage, or is there any nerve damage on the implants?
Excellent question that I didn't cover. So will I still have the same sensation? Will I be able to ejaculate? Will I still have an orgasm? Will things feel the same from the outside? The answer to that is yes. You will still have normal sensation. You'll still be able to ejaculate if you were able to ejaculate before the surgery. So those will not be affected.
And if I may, just
Mm-hmm.
another question.
Yeah.
On the implants, does it grow with you?
Well, you're lucky if you are growing.
Well, on your erection, you know.
Yeah.
When that disappears, I go, ooh, geez, yeah. You should.
So these implants were designed to expand in girth, and also some of the newer ones are designed to try to expand in length. Again, I always tell people, yeah, it's not going to be the same erection that you had when you were 18 years old. But having said that, they are trying to design it to give you a little bit more length. I don't think you'll notice that if you got an erection or an implant that your erections are as long as what you once remembered. So.
If it don't, then is it okay?
Say that again.
If it doesn't, it's okay, then you still continue to
Mm-hmm.
have the implant, but
Mm-hmm. Yeah.
the erection is,
Yeah, so the erection is still firm enough, it's still adequate for penetration for satisfactory intercourse. Mm-hmm. Mm-hmm.
okay. Thank you.
Yeah. Androgel. Okay, so list several different medications. Can any of the two affect ED? So we have a medication commonly used for depression, and bupropion, a medication commonly used for anxiety. Not typically, so the Celexa, citalopram, may cause delayed ejaculation, but how it affects the ability to get erection, it shouldn't typically. Now, having said that, I do have some men that they say they've gone on these medications and they've noticed that their erections aren't quite as strong as they used to be. Whether that is an effect of the medication, or maybe it's effect of, There's a psychiatric component to it. There's the performance anxiety. If you're on some of these medications for anxiety, we know that that may be an issue for you, and it may be an issue in the bedroom as well. But typically, these aren't the classic medications that cause erectile dysfunction. Any other questions? Feel free to just, yeah.
Okay, so you say that there's different prescriptions of like Viagra and Cialis.
Mm-hmm.
Is there anybody that's gonna give you free trial periods? Because I know that I've done one and
Mm-hmm.
they give you 5 days and that's it.
Yeah.
You know, what if that kind of works?
Mm-hmm.
Doesn't work? You
Yeah.
You need to up your dose?
Yeah, kind of depends on how many samples are in the office at that time as to how many you get. Typically, you know, when you get a big box, there's only 2 in there,
Right.
unfortunately. I try to give you enough so that you can have enough to get an idea of whether it's going to work for you or not. And sometimes I'll tell men, I'll give them the highest dose and say, break this in half, and if that half a pill works, then you just double the amount of doses that you got in this free sample pack. And so, and again, sometimes I give multiple different sample boxes. And then also, a lot of these pharmaceutical companies are giving maybe 3 free pills when you pick up your prescription, or a certain % off the next prescription. And so if your insurance doesn't cover it, or you're still paying a lot of out-of-pocket costs, there are some vouchers available that we have that we can give to you. Mm-hmm.
Are there new medications on the horizon to improve the Viagras of the world and
Yeah.
Cialis?
There's a new medication coming down called Extends. I'm not sure when that's going to be available to us, and I'm not even exactly sure of its mechanism of action. How does it work? I think it's similar to the Viagras and Levitras, and so I think time will tell. That is one of the medications. Eventually, the patent for Viagra will run out and we'll get a generic form of it. So far, even though it's been around since 1998, we still, unfortunately, don't have the generic form of it.
If there aren't any more questions, let's thank Dr. Brunford.
Got one more over here. Yep, one more over here. Yep.
Yeah, I've got 2 questions.
Yes.
One, how does your age affect it? You know, are you less likely to have problems if you're younger rather than being older?
Mm-hmm.
And 2, I take verapamil. What kind of effect did that have on it?
Yeah, so 2 good questions. Verapamil isn't one of the classic medications to cause ED, so I wouldn't stop your verapamil. That's a calcium channel blocker used to treat for high blood pressure. The other question, how does age affect it? Well, a lot of us in here probably know how it affects it. When you were 18 years old, they were fine. When you're 70 years old, they're not working quite as well. A lot of that has to do with some of the other, what we call comorbidities that come with age. The blood pressure, the cholesterol, the diabetes, the obesity, the years effect of smoking. So as you get older, the tendency is for erections to not be as good as they once were.
Can low cholesterol affect it also?
Low cholesterol? Not typically, and it depends. There's different types of cholesterol. You've probably heard of good cholesterol and bad cholesterol. Of course, we want to have a high level of good cholesterol and a low level of bad cholesterol.
Cholesterol's too low.
If the good cholesterol is too low, it depends on what the other ones are as well. And a lot of times we look at the ratio of good cholesterol to bad cholesterol. And as long as that ratio is, kind of at an optimal level, it shouldn't have a huge effect. Mm-hmm.
We know that neuropathy from diabetes type 2 affects your feet. Is it a similar mechanism affects ED?
Yeah, so if you've gotten to that point where your diabetes has affected, sensation in your feet or hands, the neuropathy, we know it's probably also had an effect on the vessels as well as the nerves that go to the penis. So there's no doubt that if your diabetes is you've had it for that long to have neuropathy, it has had an effect on the penis as well.
Is there any treatment for that at all?
Well, we kind of go through the different treatment options that I just went over. If the oral medications aren't working, you go to the next step. And if those aren't working, you go to the next step. If nothing's working, you still want some options, and you're amenable to an implant, and you're the right surgical candidate, that's an option for you. And we do have, if you didn't get one of these, do we have more back there? Yeah. So we have more of these, there's brochures back there, and in this one, it's Answers for Men. And in the back, there's a DVD, and it gives patient testimonials. A lot of these men are people that have had the implant. And so if you want to hear firsthand from patients that have had an implant what their experience has been like, there's a DVD here that talks about it. If you want to talk to a person that's had an implant, you can get a hold of us. The company that produces these implants has patient advocates. These are people that have had it done. They're willing to talk to other people that have questions about it, and we can get you in contact with those. And kind of the same thing here. This is called a trifold, and it kind of explains the different, simplifies the different treatment options that we talked about already. These are options beyond the oral medications. And if you don't get enough, if we run out, we'll get you more. We have more at our office.
Dr. Bronkhorst, thank you very much.
You bet.
You're watching City Channel 4. On TV, online, on demand, on Facebook, and now on the go on your mobile device.